Hello, good afternoon, everybody. I'm Dr. Smriti Naik. I'm a fertility specialist and gynecologist at Aikya Fertility and Research Center, Bangalore. So, welcome all to the FP Live. Today, I'll be talking to you about egg freezing, a very popular topic, a very commonly discussed topic, because here we see that, in social media or anywhere else, we are being bombarded by a lot of information on egg freezing. And so I thought, let me, try to clarify all the information that you get so that you can make a decision and understand what your options are. So we've seen, most of the celebrities, we've seen a lot of actors, we've seen people, saying that they got delivered at the age of 35 or 40 and they had like really healthy babies and they didn't have any issues. Again, here it's important to understand that probably they have frozen their eggs. We don't know for sure, but then always don't go with what you see on, on social media or with any celebrity going on about their pregnancy journey, because not always, we don't know the whole truth behind it all. So apart from that, you must be seeing a lot of, information which gives you the points about how to do egg freezing, what exactly is egg freezing, how to go about it. And, here I am just trying to bust few myths and clarify few doubts that I commonly get asked from my patients when I'm sitting in my OPD. Okay. So what is egg freezing? Egg freezing is a process in which we usually go around and freeze the oocytes after ovarian stimulation. So the stimulation happens in such a way which is very similar to IVF, where injections are given on a daily basis and we will be monitoring the follicular growth. We will see how the follicles are coming up. And at the right time, when these follicles have grown to a size of a mature size, we will retrieve these eggs and we will freeze them. Again, considering what is the patient's situation, if they're married but they're not yet ready to have a baby, we may inject the eggs with the husband's sperm and then freeze the embryos, which have a better success rate, which I'll be talking about later. Or if the patient is unmarried and still undecided about the partner, we will just freeze the eggs. So way back in 1986, it has been reported, the first birth has been reported of, a pregnancy which happened using a frozen oocyte. So it's been a long way right now, 1986, and now we're, in 2023. So there has been a lot of ups and downs in this egg freezing, and off late it has come up because of the fact that people, or rather women, are taking the choice of trying to start a family into their own hands. They want to control the biological clock. There are women who are career oriented. They want to reach up the ladder of, in their career. And so they don't want to lose out on also becoming a mother. But it's important that they have to understand what the options are. Always be, emotionally aware of what your needs are. And yes, it's good to be career oriented, but because it's so dependent on time, it's important to also understand that you need to think of options like egg freezing. So that is called social egg freezing. Now, why should you do it? What is social egg freezing? It's a concept where you freeze your eggs without having any infertility issues, just for the purpose of postponing childbearing. So again, why should you do this? One thing you should understand is that ovarian reserve is always going to be declining as you grow older. Okay. And this is a fact that not many people are aware of. But once you cross the age of 30 or 32 and onwards, the number of eggs in your ovaries comes down drastically. And if you're not having a healthy lifestyle, the rate at which it gets depleted is even faster. So if you're planning to postpone your pregnancy, please get your fertility assessment done, which is through a simple blood test called EMH and a scan where we check for the antral follicle count. So getting back to why you should be doing your egg freezing, almost 1 in 4 women above the age of 35 suffer from infertility. And at the age of 35 to 40, your fertility would have declined by almost 90%, right? So these are facts that we get through studies and we try to understand. So what is the reason you should be freezing your eggs at an earlier stage? It's not going to be of much help if you decide, okay, I want to freeze my eggs at the age of 35 or above, because then the quality of eggs that we get at that age will be quite less, and the number will be less, and the quality also will be poor. Okay. So 1/3 of women from 35 to 39 suffer from infertility, and that number increases to 2/3 for women above the age of 40. Okay. So there is a good graph that I would have showed you otherwise, but it shows the decline, in a graphical representation of how the eggs get depleted once you grow older, and once you reach 37, the decline is so much so that your eggs reach a number of just 25,000. So indications, again, they can be, like I've spoken only about social, but there's also medical indications. This is there for patients who have any sort of cancers diagnosed, which is a very unfortunate condition to be in. But then if you do have any cancer diagnosed, please consult a gynecologist or a fertility specialist before you start with a chemo or a radiotherapy, because those are the drugs which can directly go and impact your ovarian reserve or fertility. And because of that, your chances of conceiving later on come down. Hence, it is important to freeze your eggs before you go ahead for your chemotherapy or radiotherapy. There are a lot of options available to freeze your eggs in many fertility centers, and all you need to do is reach out when you're thinking of freezing eggs for a medical reason. The other is social, which I already spoke about. Career aspirations, not finding the right partner, not ready to start a family. These are conditions where you'll have to do a social egg freezing. So what is the process of egg freezing? It's again very simple and easy to understand. We start the injections on day 2 or day 3 of the cycle. And this is, of course, done only after scan and baseline blood tests. Once this is done, we get to know if everything is normal. We start with injections, and we call the patients back frequently every once in 2 to 3 days to check with the scan about the follicle growth. If the follicles are growing well, we tweak the injections a bit, and we get the patient prepped up so that they are ready for an oocyte retrieval. So I would say a continuous injection days of around 10 to 15 will be there, and around 15th day, in and around the 15th day, your eggs will be ready, and we will be planning a oocyte retrieval. The oocyte retrieval is a simple daycare procedure. It is done in the clinic, in the IVF clinic, and you come on an empty stomach in the morning. We retrieve the eggs through a transvaginal scan. We attach a needle to the transvaginal probe, and we retrieve all the eggs out, and we hand it over to the embryologist. Once the retrieval is done, and it is done under short general anesthesia, in which you'll be sedated, you will not be aware of the procedure happening, and it takes around 30 to 40 minutes. What are the complications of oocyte retrieval? Well, here we can have injury to the bowel, bladder, or blood vessels, because it is a needle which is going through the ovaries to retrieve the eggs. Again, a very rare complication. We don't usually see it very commonly. But yes, to state few complications of oocyte retrieval, that can be one. And of course, the anesthesia complications can be the second thing. Now, apart from this, once the eggs are retrieved, we give it to the embryologist, and they go ahead and grade the eggs, and they will assess which are the good eggs to be frozen and which are the eggs which are not of a good grade and can be discarded. Accordingly, we'll be telling you how to go forward. On the day of the retrieval, you can go home, you can relax, you can have normal home cooked food. You don't have to be at bed rest, and probably rest it out the next day as well. So we ask patients to just take off for at least 3 days after the retrieval from work, so that you can relax and recuperate and join back your work maybe after 3 days, right? So once that happens, you will be given information on how many eggs were retrieved, and then of course we'll give you all the antibiotics and painkillers and discharge you home. So yeah, and just to understand if there's any issues here, again with the eggs which are retrieved, sometimes the number of follicles that are counted will be different from the number of eggs that we actually retrieve and the grade of the egg. So let's say we're expecting around 10 eggs to be coming up. Because we're seeing 10 follicles, that may not always correlate. We may actually retrieve lesser number of eggs compared to the follicle. This can happen sometimes, and it is dealt with by assessing what can be done differently the next time if we have to change the protocol. There are different protocols through which we retrieve the eggs and the stimulation protocols which are there. And if we don't retrieve good number of eggs or we retrieve more immature eggs, then we need to change the protocol in the next IVF cycle. For some patients, we also go ahead and advise them to go for embryo pooling or oocyte pooling, in the sense that they may require more than one cycle of an IVF or more than one cycle of retrieval, because studies show that for having one live birth, we need to retrieve at least 10 to 15 oocytes. So there is an attrition rate at every level. That is also something that you should understand, that if you retrieve 10 to 15 number of oocytes and then inject it with the sperms, that it's not always necessary that we will be getting 10 to 15 embryos. There is an attrition rate at every stage. So 10 to 15 eggs, out of which maybe 8 to 10 will be of a good grade, like an M2. And then out of these 8 to 10 which get fertilized, 6 may get cleaved or divided. And finally, we may be left with 6 good grade A embryos, which is what is required for a healthy and successful pregnancy. So again, the attrition rate is something you should understand. We're not always left with the same number of embryos as the same number of oocytes. So you may require to go for more than one cycle of oocyte retrieval to pool all these oocytes at the end of the day, so that we can achieve at least one live birth. So cost of egg freezing again depends on your age, your baseline AFC, the AMH. Again, I'd like to reiterate that it's important to do this earlier on than as a last resort once you've crossed the age of 35. Because here what happens is, the earlier you do it, the number of eggs retrieved and the quality of eggs will always be better. So the number of cycles you may have to do of oocyte retrieval may actually reduce and reduce your cost factor. But the later you do it, after 37 or 38, the number of eggs retrieved may be lesser, and you may require to do more than one cycle of oocyte retrieval, which will again double your cost and double the time required to finally get the appropriate number of oocytes that we need for one live birth. So then, very commonly asked question again is, what are the risks and the side effects of this? So again, we can divide it into different phases. So the most first commonly noted side effect is when you're taking the hormonal injections. So here you'll be taking daily injections. Of course, yes, these are painful injections, but they are not the big thick needle ones which are given to the gluteal region. These are injections which are given to the thighs, and they are very advanced technology sort of injections where the needles are very thin and you'll hardly feel like a pinprick, and there's no swelling or a lot of pain which happens after these injections. It's a momentary sort of pain, and it usually goes away once after 5 to 10 minutes after the injection is administered. But having said that, these injections do have certain side effects, like they can cause nausea, they can cause bloating, because we are stimulating your ovaries, right? And normally in every cycle, you get 1 to 2 eggs. But in an oocyte retrieval or an IVF cycle, we want as many eggs as possible. So we will be trying to give you more injections so that we can retrieve as many eggs as possible. So as the ovaries grow in size, you will feel a little bit of lower abdominal pain. You may feel bloating, again nausea, and just a little bit of fatigue. So I always advise my patients to take a lot of proteins and a lot of water during this stage, because it helps to, breeze through this phase. Again, it's all, relative. Some patients do really well. They don't really feel, they in fact continue with work when they're taking these injections. But some patients are quite debilitated. They do have some side effects, which, we have to again deal with by giving them some antacids or antiemetics, right? So these are the side effects during your stimulation cycle. Again, what are the side effects after your oocyte retrieval? I've already mentioned the complications, but again, the side effects can be some amount of lower abdominal pain, or you can feel a little bit of bloating, or you may feel like post-procedure, a little bit of spotting can happen. Of course, the pain we deal with by giving painkillers. If there is too much of bloating, too much of vomiting or abdominal distension, we ask the patients to come back and meet us. But these are the side effects of the oocyte retrieval. Again, you can ask me what are the side effects after the eggs are retrieved, and let's say you get a partner, find a partner to have a baby with. So once the embryos are created, usually we go ahead and put 2 embryos because we want a good success rate, right? We want to have a maximum success rate. We want to have a maximum success rate for the patient. So we put in 2 embryos, and this can lead to multiple births. Again, this is an option. We talk to the patient, we ask them if they want one single embryo transfer or they want 2 embryos. For patients, in the first time, we give them the option of single embryo transfer, telling them that the success rate may be slightly lower than when we put in 2 embryos. Out of the 2 embryos, at least we hope that one gets implanted, so we put in 2. For patients with recurrent implantation failures or recurrent IVF failures, we do something called sequential transfer, where we put in even up to 3 embryos. We put a day 3 embryo and a day 5 embryo. So again, these options are, discussed with the patient and then decided. But yes, when we put in 2 embryos, the main complication we're dealing with is multiple births, and twins come with a whole set of complications, which we all know, preterm birth, premature rupture of the membranes, water leak, and then you'll have to put a cervical stitch because, the pregnancy has to be retained inside. So such things, right? So definitely, this is a discussion we can have for later on when you decide, okay, it's time for me to get pregnant, whether you want a single embryo or 2 embryos to be put inside. So again, few of the myths. Okay, so this is the basic discussion that I made about egg freezing. Some of the myths I want to discuss about that I keep hearing about egg freezing or IVF in general is, the first one is egg freezing is only for older women, right? This is the most common myth. Like, I'm just 28 or 29. I still don't know who my partner is going to be, but should I really freeze my eggs right now? Well, it depends, on your timeline. Like, when are you planning to get married or when are you planning to start a family? First and foremost, getting your fertility assessed is very important, because we do see a lot of girls who are very young, and because of their lifestyle or environmental changes around them, exposure to plastic, exposure to, radio frequency, we get exposed to Wi-Fi all the time. So we don't really know the side effects of all this, but somehow we are seeing a lot of young girls with low AMH, that is your anti-Mullerian hormone. AMH is the most common and easiest blood test that you can do to get your fertility assessed. If it is in a good range, anything about 2.5, 3, it's an excellent fertility, value. And we can definitely think of postponing childbearing, or we don't have to think of freezing eggs. If it is less than 1.5 or in one range, then that means that we are looking at a low fertility, low ovarian reserve. Again, I would insist you correlate this with your pelvic scan, because there we assess the antral follicle count, and that with the AMH gives us an idea whether really your fertility is reduced or not. We have seen some discrepancies where AMH is very low, but when we do the scan, the follicle count is extremely nice. So then we are thinking, what's happening here? And the other way around as well. AMH is very good, but then when we do the scan, the follicles are not there. So always both go hand in hand, AMH and your antral follicle count. So this you will get to know. And again, it is not always age dependent. A young patient can have low ovarian reserve with low AMH and low antral follicle count. And a patient recently that I saw, an older patient of 35 or 36 had an excellent AMH of 3.4 and very good antral follicle count. So it's all to do with your lifestyle, the environment you are in, your habits, your genes, multiple factors which dictate how your fertility is going to go. So don't think that IVF or egg freezing is only for older women, right? Understand what is your fertility status and then proceed with it, right? That's the first myth. The second myth is egg freezing guarantees a pregnancy in the future. Now, okay, you've frozen your eggs. So is it like 100% I'm going to have a baby no matter what? Again, please understand that egg freezing and embryo freezing are very different things. When you freeze an egg, an oocyte, that is an egg, right? It's the biggest cell in your body. It contains a lot of water. So when you freeze it, okay, although with a lot of advanced technology, we are getting very good success rates where they're getting thawed and the oocytes are surviving it. But then, what happens is these oocytes may not survive the thawing process. And so we're not left with the number of oocytes that we actually froze. That is why I already spoke to you about how oocyte retrieval should be coupled, and you may require more than one cycle of oocyte retrieval. So, having said that, pregnancy is not always guaranteed. Once you've frozen your eggs, we do thaw them and some of them don't survive. And then after thawing them, we inject it with the sperms, make it into embryos. Some of the eggs may not grow till a day 5 embryo. Day 5 is a blastocyst embryo, which is the excellent grade of embryo. Sometimes they may just stop at day 3, get arrested. So we may be left, if you're frozen like 10 eggs, we may be left with only 2 to 3 embryos at the end of the day, right? So it's not always like a guaranteed pregnancy. And also the other thing is you cannot always think that, okay, I've frozen my eggs, so I don't have to bother about pregnancy for the next 10 years. Ideally, you should think of utilizing your eggs for the next 5 years, because as you grow older, right, the body itself can develop sugar, diabetes, like, blood pressure, thyroid issues. So again, you having to carry the pregnancy for 9 months becomes challenging. So always, there's no guarantee that, okay, I've frozen my eggs, I'm definitely going to have a pregnancy in the future. You need to be smart about it. You need to understand when you want to decide to utilize these eggs to have a pregnancy. Yeah, the third most common myth is it's a very painful procedure. Like I already mentioned, the injections are, of course, painful, but we have very thin needle injections which don't cause a lot of pain like how it used to be before. And the oocyte retrieval is done under anesthesia, so that procedure is also not very painful. You may have slight discomfort at the end of the procedure, and good painkillers help you relieve with it. So there isn't any major issues with the pain per se. The next one is frozen eggs have a limited shelf life. Of course, like I already mentioned, within 5 years, plan to utilize these eggs because you don't want to grow really old at the age of 40 with hypertension and diabetes and then utilize these eggs to have a carrier pregnancy, because then your 9 months of pregnancy itself will get complicated, and then having a healthy baby at the end of it will become more challenging. So at the age of 30, 29, 30, 31, get your fertility assessed, freeze your eggs if you're still not found your partner, still planning not to get married for the next 2-3 years, or if you're married and don't want to have a baby for the next 3-4 years, freeze your eggs and then plan to utilize it in the next 3 to maximum of 5 years. Yeah, the next myth that I keep hearing is egg freezing only for single women. Again, that's not true. I already mentioned, if you're married and still not ready to have a baby, you want to plan to postpone childbirth, you want to plan to postpone starting a family, take a time out to understand what your fertility is, meet a fertility specialist, and then take the decision that, okay, I want to push it for 2 to 3 years. I still remember I had a patient who had major career plans, wanted to completely shift to Germany. But then when I did her scan, I found that her antral follicle counts were very low. So I had to, convince her to listen, please start planning for pregnancy and then plan your career shift to Germany. Because once you go for 3 years to Germany and then you come back, your follicle count would have drastically reduced. And then for you to get pregnant is going to become difficult. So she had to completely change her career plans because her antral follicle count was very low, which she had never got assessed before. Okay. Yeah. So the last one is, the last myth is egg freezing is too expensive and not accessible. Well, like I already said, we're being bombarded by a lot of messages on social media. It is definitely very accessible. A lot of centers offer egg freezing. And, we have all the facilities available at Aikya to help you out with your egg freezing journey. Please, do come down, have a consult, understand what is your fertility potential. Do you even need egg freezing? That's also important, right? We don't simply advise egg freezing for everybody. If you have, let's say, a fiance, you're planning to get married soon, and you want to know if you should freeze your eggs, you can always come down, get an understanding of whether it's really required for you or not. Okay. Lastly, I'd just like to say that it's, a very revolutionary advancement in technology where you can actually pause your biological clock and you can, you have control over your fertility. You have control over when you want to start your family. And this is a technology which was not available a few years ago. But then, we've all heard of Diana Hayden, the celebrity who actually availed this technology. And she had her first baby at the age of 34 or 35. Then she went on to conceive twins at the age of 42. So, 40 plus, but she had 3 healthy babies because she had frozen her eggs way early at the age of 30 or 32, after she became Miss Universe. So she actually availed this technology and took advantage of it, and very nicely, everything worked out well for her. So there are a lot of celebrities out there who have used this technology because they cannot, stop their career because of pregnancy. So please, think about it and discuss it with your partner, discuss it with your parents, and come down for a consultation to understand the process in more detail. And we'll be more than happy to help you out. So some of the celebrities who've actually frozen their eggs actually came out and encouraged other people. Mona Singh has done it. Tanushri Mukherjee, who's Kajol's sister, they have done it. And they actually encouraged other women to do it because, it's something that I think a message to spread all over. So, this is my message to all you guys. I hope that this really helps you out to understand the process. And like I said, we're always here to help you out. And do come down and meet us and get more information on egg freezing. So I have one question here, which is what is the earliest age you can freeze your eggs? So the earliest age you can freeze your eggs, that's an excellent question. So again, a girl should be a major, that's important. But having said that, you need to know what is your timeline, right? And understand what is your fertility. If you're having an excellent fertility also, but you're sure that, listen, my career is going to go on and I'm going to reach the top of my career ladder for the next, let's say, 8 years, and I'm not planning to have a baby for the next 8 years. So the earliest you can do is, even as early as 23, 24, because, that is when your eggs will be of an excellent quality. And let's say you know for sure till the age of 35, you're not going to have a baby, then you can actually avail those eggs which you're frozen at an earlier age, and use that to have healthy babies when you're of a older age, like 34, 35. So yeah, that's the only question here. Please do drop down any questions that you have in the comment section, and we'll definitely get back to you and try to help you out with whatever doubts you have. Thank you so much for joining in and listening to this FB Live. We'll be coming back with more interesting topics for you. Please put down in the comment section if you want to discuss any topics or you want me to talk on any common topics that you feel you have questions on. Thank you for joining in again.